Hey guys, today we're going to talk about therapeutic utility of a combined glutamine and polyunsaturated fatty acid supplementation in patients with heart failure. Some background knowledge and some background information and knowledge gap. According to the Canadian Cardiovascular Society, 750,000 Canadians live with heart failure, impacting their quality of life. Heart failure often follows conditions like myocardial infarction or high blood pressure, which impairs the heart's ability to pump blood effectively. This can lead to symptoms like shortness of breath, leg swelling, and exercise intolerance, while treatments like diuretics and vasodilators help manage symptoms and prevent further damage, but they can't cure heart failure. This limitation has led the researchers of this study to explore combined dietary supplementation of omega-3, PUFA, and glutamine in chronic heart failure patients, aiming to find more effective interventions.
Alright, for their primary experimental design, they underwent a double-blind experiment wherein they had a placebo group and a treatment group, where the placebo group was given milk powder and safflower oil, and the treatment group was given the L-glutamine plus fish oil supplementation. Additionally, to test things like exercise tolerance, they underwent a cardiopulmonary exercise test utilizing bicycle ergometer. You underwent a hand grip test as well as a 6-minute walk test. They underwent visceral tissue biopsies and underwent immunohistochemistry to look at various muscle fibers. We utilized liquid chromatography and mass spectrometry to look at lipidomics. Underwent liquid scintillation to look at things like fatty acid oxidation rates. Underwent echocardiograms to assess things like blood flow within heart valves. Underwent a quality of life questionnaire and a body composition test on the placebo and treatment groups, utilizing dual energy X-ray scanning, with the final gene expression analysis on various inflammatory markers of the blood through RT-PCR.
As for the results, none of the exercise parameters altered. Combination supplementation did not improve muscle function or systemic inflammation. Active therapy did not improve peripheral skeletal muscle metabolism or morphology compared to the placebo group. However, the active therapy group increased lean body mass and quality of life questionnaire, suggesting potential benefits in future.
Diving into the discussion, the myocardium switches from normally using fatty acid for ATP generation to glucose in the failure state. This is suggested to be due to taking on a transcriptional state similar to that of a fetus heart, where there is reduced expression of necessary beta oxidation enzymes such as CAT1. In addition, exercise intolerance in heart failure patients is due to metabolic switch where type 1 oxidative fibers decrease in number. In a whole another study, polyunsaturated fatty acids were studied on a bigger population for healing. Interestingly, fish oil is rich in these lipids. They believe these lipids reduce inflammation and lower heart failure mortality. Scientists try to understand these properties. First, they suggest that polyunsaturated fatty acid double bonds may eliminate reactive oxygen species directly or through metabolites. Second, polyunsaturated fatty acids are crucial for cell signaling. After binding to the GP120 receptor, omega-3 fatty acid block the NF-κB pathway. Activation is important for the immune response, but too much can cause tissue scarring and fibrosis. Polyunsaturated fatty acid inhibit NF-κB and prevent scar tissue formation. Many studies have indicated that polyunsaturated fatty acids protect the heart. This is done by stabilizing membranes and improving mitochondria. Since glutamine and polyunsaturated fatty acids are anti-inflammatory, it seemed unusual that the combined supplementation didn't reduce inflammation. Glutamine lowers inflammation by forming glutamate and glutathione. GSH, also known as reduced glutathione, sacrifices its own function to protect vital cells sections from ROS or reactive oxygen species oxidation. Additionally, it was found that glutamine reduces intestinal mucosal pro-inflammatory cytokines. In contrast, our results demonstrated no substantial decrease in TNF-alpha production.
Alright, glutamine has many metabolic roles. In addition to its serving as an amino group carrier in the urea cycle, serving as an anaplerotic metabolite, it is also the primary fuel utilized by immune cells and during hypercatabolic conditions such as when the body is recovering from a burn. This is attributed to its pro-anabolic properties where it not only stimulates protein synthesis, but such as activating expression of protective heat shock proteins. However, due to its, despite its use in many metabolic conditions, its therapeutic use in treating cardiovascular disorders is controversial. Several studies have noted the protective role of glutamine against developing cardiovascular disease. An example being ischemia reperfusion injury, in which it is normally a fatal condition that after normal restoration of normal blood supply to previously hypoxic tissue causes oxidative stress and cell death. Glutamine protects against this by stimulating myocardial repair, which limits cardiac damage. On the other hand, glutamine can actually aggravate certain cardiometabolic conditions. An example being pulmonary arterial hypertension. This phenomenon is actually very similar to what we've previously observed in cancer cells, where they become addicted to glutamine. Vascular endothelial cells become addicted to glutamine and through increased glutaminolysis manage to hyperproliferate, which leads to a vascular remodeling and resulting in high blood pressure and right ventricular damage. Now, why did the researchers perform immunohistochemistry on muscle biopsies? Several in vitro studies in the past have shown that glutamine is able to change the expression levels of contractile proteins such as the alpha-myosin heavy chain. However, this has been suggested to be mediated by glutamine's role in the mTOR pathway. However, the lack of results in our study show that this is likely only an in vitro phenomenon and something that does not take place inside the actual cell. Lastly, the lack of improvement in exercise tolerance was surprising, considering that glutamine is an anaplerotic metabolite and able of increasing TCA cycle flux. This lack of results can be explained by several factors, the biggest one being the limited sample size, as well as the researchers providing no rationale whatsoever behind the dosage and frequency of the supplementation.
And lastly, another quick summary of what we just talked about. Thank you for listening.